Are you or a loved one struggling with ADHD symptoms and searching for a medication that can provide relief? In this video, we will unveil the key differences between two popular ADHD medications, Strattera and Vyvanse. With so many options available, it can be overwhelming to navigate through the sea of ADHD medications. That's where we come in. We will break down the unique features and benefits of both Strattera and Vyvanse, allowing you to make an informed decision that best suits your needs. Strattera, also known by its generic name atomoxetine, is a non-stimulant medication that works by balancing neurotransmitters in the brain. On the other hand, Vyvanse, or lisdexamfetamine, is a stimulant that increases the levels of certain chemicals in the brain. Both medications have been proven to effectively reduce symptoms of ADHD, such as inattention and hyperactivity. However, they have different mechanisms of action, potential side effects, and dosing options. By understanding the nuances of each medication, you can work with your healthcare provider to find the best treatment plan for you. Join us as we dive deeper into the world of ADHD medications and explore the differences between Strattera and Vyvanse. Together, we can find the relief you deserve. Understanding ADHD and its symptoms. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder characterized by a persistent pattern of inattention, hyperactivity, and impulsivity. It commonly affects children and adolescents, but can also continue into adulthood. The symptoms of ADHD can vary from person to person, but generally include difficulty paying attention, being easily distracted, struggling to follow instructions, forgetfulness, impulsivity, and excessive fidgeting or restlessness. These symptoms can significantly impact an individual's daily life, including their academic performance, work productivity, and relationships. It is important to note that ADHD is a medical condition and not simply a result of laziness or lack of discipline. It is caused by a combination of genetic, environmental, and neurological factors. While there is no cure for ADHD, there are various treatment options available to manage symptoms and improve quality of life. Overview of Strattera and Vyvanse. Strattera and Vyvanse are two commonly prescribed medications for the treatment of ADHD. While they both aim to alleviate ADHD symptoms, they have different mechanisms of action and chemical compositions. Strattera, or atomoxetine, is a selective norepinephrine reuptake inhibitor, SNRI. It works by increasing the levels of norepinephrine, a neurotransmitter involved in regulating attention and impulse control in the brain. Unlike many other ADHD medications, Strattera is not a stimulant and does not have the potential for abuse or dependence. Vyvanse, or lisdexamfetamine, is a prodrug of dextroamphetamine. It is classified as a central nervous system stimulant and works by increasing the levels of dopamine and norepinephrine in the brain. Vyvanse is a long-acting medication that provides a sustained release of the active drug throughout the day. Both Strattera and Vyvanse have been approved by the U.S. Food and Drug Administration, FDA, for the treatment of ADHD in children, adolescents, and adults. However, they have distinct characteristics that may make one more suitable for an individual's specific needs. How Strattera works for ADHD symptom relief. Strattera works by selectively inhibiting the reuptake of norepinephrine in the brain. Norepinephrine is a neurotransmitter that plays a key role in attention, focus, and impulse control. By increasing the levels of norepinephrine, Strattera helps to improve attention span, reduce impulsivity, and decrease hyperactivity. This can lead to an overall improvement in ADHD symptoms and an enhanced ability to concentrate and complete tasks. Unlike stimulant medications, Strattera does not directly affect dopamine levels. This can be advantageous for individuals who may have comorbid conditions or contraindications to stimulant use. Additionally, Strattera does not have the potential for abuse or addiction, making it a preferred option for some patients. However, it is important to note that Strattera may take several weeks to reach its full effectiveness. This means that patience and consistent use are necessary to experience the maximum benefits of the medication. How Vyvanse works for ADHD symptom relief. Vyvanse, as a prodrug of dextroamphetamine, is converted into its active form in the body. Dextroamphetamine is a potent central nervous system stimulant that increases the levels of dopamine and norepinephrine in the brain. By enhancing the activity of these neurotransmitters, Vyvanse improves attention, reduces impulsivity, and decreases hyperactivity. It helps individuals with ADHD stay focused, complete tasks, and better manage their symptoms. One advantage of Vyvanse is its extended release formulation, which provides a steady release of the medication throughout the day. This means that individuals only need to take Vyvanse once a day, avoiding the need for multiple doses or midday administration. However, it is important to note that Vyvanse is a controlled substance due to its potential for abuse and dependence. It should only be used under the supervision of a healthcare provider and in accordance with prescribed dosage guidelines. Comparing the effectiveness of Strattera and Vyvanse. Both Strattera and Vyvanse have been shown to be effective in reducing symptoms of ADHD. However, the specific effectiveness may vary from individual to individual. In clinical trials, Strattera has been found to significantly improve ADHD symptoms compared to placebo. It has been shown to enhance attention, reduce hyperactivity, and improve overall functioning in both children and adults with ADHD. Vyvanse has also demonstrated efficacy in treating ADHD symptoms. Studies have shown that individuals taking Vyvanse experienced significant improvements in attention, impulse control, and hyperactivity compared to those taking a placebo. It is important to work closely with a healthcare provider to determine the most effective medication and dosage for each individual. Factors such as medical history, other medications, and individual response to treatment should be considered when making a decision. Side effects and safety considerations of Strattera. Like all medications, Strattera can cause side effects. Some common side effects of Strattera may include nausea, vomiting, upset stomach, decreased appetite, dry mouth, dizziness, and fatigue. These side effects are generally mild and tend to improve over time. In rare cases, Strattera may also cause more serious side effects, such as liver problems, increased heart rate, high blood pressure, and mood changes. It is important to discuss any concerns or unusual symptoms with a healthcare provider promptly. Strattera may also have some potential drug interactions. It should not be taken with monoamine oxidase inhibitors, MAOIs, or within 2 weeks of discontinuing an MAOI. It is important to inform the healthcare provider of all medications, including over-the-counter drugs and supplements, being taken to avoid any potential interactions. Side effects and safety considerations of Vyvanse. Vyvanse, being a stimulant medication, can also cause side effects. Common side effects of Vyvanse may include decreased appetite, insomnia, headache, dry mouth, increased heart rate, and elevated blood pressure. These side effects are usually mild and tend to resolve with continued use. In rare cases, Vyvanse may cause more serious side effects, such as cardiovascular problems, psychiatric symptoms, and allergic reactions. It is important to seek medical attention if any concerning symptoms arise. Vyvanse, being a controlled substance, has the potential for abuse and dependence. It should only be used as prescribed and under the supervision of a healthcare provider. It is important to follow the prescribed dosage instructions and not share the medication with others. Choosing between Strattera and Vyvanse for ADHD treatment. When it comes to choosing between Strattera and Vyvanse for ADHD treatment, several factors should be considered. Individual differences such as age, medical history, and personal preferences play a crucial role in determining the most suitable medication. For individuals who cannot tolerate stimulant medications or have a history of substance abuse, Strattera may be a preferred option. On the other hand, Vyvanse may be more appropriate for individuals who require a long-acting medication or have a positive response to stimulant therapy. It is essential to consult with a healthcare provider who specializes in ADHD to discuss the unique circumstances and make an informed decision. They will consider the individual's specific needs, potential side effects, and desired outcomes to create a personalized treatment plan. Alternative treatment options for ADHD. In addition to medication, there are alternative treatment options available for managing ADHD symptoms. These may be used alone or in combination with medication, depending on individual needs and preferences. Behavioral therapy, such as cognitive behavioral therapy, CBT, and behavior modification techniques, can help individuals learn coping strategies, improve organizational skills, and develop healthier habits. This type of therapy aims to address the underlying issues associated with ADHD and teach individuals practical skills to manage their symptoms. Lifestyle modifications such as regular exercise, adequate sleep, and a healthy diet can also play a significant role in managing ADHD symptoms. Engaging in physical activities, getting enough rest, and consuming a balanced diet can improve focus, reduce impulsivity, and enhance overall well-being. Additionally, support groups and educational resources can provide valuable information, guidance, and emotional support for individuals with ADHD and their families. Connecting with others who are experiencing similar challenges can help reduce feelings of isolation and provide a sense of community. Conclusion: Strattera and Vyvanse are two popular medications used for the treatment of ADHD. While both medications aim to alleviate ADHD symptoms, they have different mechanisms of action, potential side effects, and dosing options. Strattera, a non-stimulant medication, works by balancing neurotransmitters in the brain. It offers advantages such as no potential for abuse or addiction, making it a preferred option for some individuals. On the other hand, Vyvanse, a long-acting stimulant, increases the levels of certain chemicals in the brain. It provides sustained symptom relief and convenient once-daily dosing. When choosing between Strattera and Vyvanse, it is important to consider individual factors, consult with a healthcare provider, and weigh the potential benefits and risks. Additionally, alternative treatment options, such as behavioral therapy and lifestyle modifications, can complement medication therapy and enhance overall symptom management. Remember, finding the right treatment plan for ADHD is a personal journey that requires patience, open communication, and a comprehensive approach. With the right support and guidance, individuals with ADHD can thrive and lead fulfilling lives. Thanks for watching.